Good day everyone, I am Jennifer Elmadamba, a student nurse from Isabela State University at Tiague campus. Today I will be going to perform assessment of skin, hair, and nails. First, we need to perform hand washing. Next is to gather all equipment and materials needed. So as we can see, I am using a gloves to prevent any cross-contamination. Next is to a client's gown, a ruler to determine if there are any lesions for it. Next is to explain the procedure to the client. Good day, sir. I am Jennifer Elmadamba, a student nurse from Isabela State University at Tiague campus. Today, I will be going to assess your skin, hair, and nails. So the purpose of this is to provide a physical data about your functional ability and identify areas of health promotion and disease prevention. Is that okay with you, sir?
It's okay, ma'am.
Can I have your name?
I am Ian Dave Sarmiento.
When was your birthday?
My birthday is January 4, 2000.
I will just ask you some questions. Do you experience pain, itchiness, or numbness?
No, ma'am.
Do you experience dye in your hair?
Yes, ma'am.
When was the last time?
Last year, ma'am.
Okay, thank you, sir. Can you please wear a gown?
Okay, ma'am.
Thank you, sir. Okay. First thing we do is to note for any distinctive odor emanating from the skin. Okay. Next is to inspect for the generalized color variation. So what we are looking here are the signs of the cyanosis, jaundice, erythema, vitiligo, pallor, and even dark spots. Okay, the skin are tanned. Next is to check for skin integrity, noting on skin breakdown by paying attention on pressure areas. So the skin are intact. Next is to inspect for primary, secondary, and vascular lesions. Note for its size, shape, location, distribution, and configuration. Sir. Your hand again, sir. Okay, so we will be using a ruler. So as we can see, the client has a scar on his face. Next is to palpate for the lesions using the thumb and the index finger. Next is to palpate for the texture of the skin using the palmar surface of the 3 middle fingers. First, to determine if it is rough, smooth, or dry. See? Next is to palpate for the temperature and moisture of the skin on the client's sternum using the dorsal surface of the palms. Your sternum, sir. Your hands. Next is to palpate for the thickness using the finger pads. Sir. Next is to palpate for mobility and turgor over the sternum of the client. Is it okay if I go back again on your sternum, sir?
It's okay, ma'am.
Okay. Sir. Next is to palpate for the edema, if there are signs of edema over the feet of the client. Sorry, sir. Let me put your hand. The other one. Okay. Okay, so there are no signs of edema as the skin goes back. Next is to assess the client's hair. First is to inspect for the color. Next is to inspect for the amount and distribution. Also inspect and palpate for the texture, thickness, oiliness, parasites on the hair. Okay. Next is to inspect for the client's nails. May I have your nails, sir? So what I will be looking here is for the grooming and cleanliness of the nails. So again, your feet, sir. Okay, the nails are all clean. Next is to assess for the amount and markings. So on the client's hand, I see some longitudinal ridges. While on the client's feet, there are no signs of ridges. Next is to inspect for the shape of the client's nails. Can you do this, sir? Okay. The client's nail shape is 160 degrees between the nail base and the skin. Okay. Next is to check for the texture and consistency of the skin. Next. Next. Okay, the nails are all normal. As I assess it, the color brings back to pink and are all intact, and there are no signs of moving nails. Next is to test for capillary refill. May I have your nails again, sir? So by pressing the thumb briefly and check when the color changes. Again. Next, sir. Okay, on your feet. Next. Okay, the pinkish color brings back when I press the client's nails. Okay, that's all. Again, thank you, sir. Don't you worry because all the informations will be kept confidential.
Thank you, ma'am.